Francis Peabody noted, the secret for the care of the patient is in caring for the patient. So, medicine is personal, face-to-face, and when it's personal, it works. And this was really emphasized in my experiences in Japan. This is land of the world's fastest medicine and the world's slowest medicine. Let me set the context. So I went to Japan as a visiting professor to study traditional Japanese herbal medicine because Japanese medical students were being taught to prescribe these ancient multi-herb formulas that are approved by their FDA equivalent, covered by the National Health Plan, and apparently widely prescribed. We don't know anything about it. I went to learn. So first day I go down to Kampo Clinic. I arrive and I'm handed the sheet. Here are your patients for today. 45 patients. And I'm just like, oh my God, there's been some horrible mistake. And that's really the case of first day panic. I said, I don't speak Japanese, and please excuse me, I misunderstood. And oh, lo and behold, if they were in English, I couldn't see 45 patients in a day, or in the morning, in 3.5 hours. And this guy, oh, don't worry, you're working with Dr. Watanabe, you know, take care of everything. Well, I have to tell you, that morning, we saw 45 patients between 8:30 and noon. And the patients smiled, they were happy. Dr. Watanabe smiled and happy. I was having a heart attack as I see charts stack up. 12 people were waiting to be seen. Oh, it was just kind of like, it was a bit of a traumatic situation, but we finished it, and I'm just kind of like, wow, this is amazing. And so Dr. Watanabe said, I'd like to introduce you to my boss, head of cardiology. So I go up and do my honorific gifts and bowing, and like I said, you must be so proud of Dr. Watanabe. We saw 45 patients this morning with a smile. The patients were happy, he was happy, things were going well. I've never seen anything like this in my life. And the head of cardiology goes, huh, that's nothing. I see 90 to 100 a morning. And he wasn't kidding. Fast medicine means circling up chairs, and you go around the circle for 3.5 hours, 2 minutes per patient. Wow. So if you were thinking about the panic of maybe 5 patients an hour, try 25 patients an hour. Huh. But, perhaps equally shocking, the average length of stay for an inpatient is more than 4 weeks. In fact, when Dr. Sweet talked about the slow medicine inpatient service, I thought that's exactly what it is. It's kind of, there was time to think, there was time to ponder, there was time to work up. You can't do it in an outpatient clinic. You admit people for a month. Wow. Well, this led to kind of another knock me out of my chair moments. When I was discharging a patient from the hospital, and the government forms was this, Chi-Yu. And this is kind of the best box you can check when discharging someone from the hospital. Complete recovery. Now, the first character here is the character used to control, fix, govern, or cure. The second character is a bit different. And I want to focus on this for a moment. It's got 3 elements here. The first element along the left side indicates illness. You only see this in illness words. The second character in the middle is an image of a hollowed out log going down a stream, which is the image for movement or conveying or transport and the like. And the bottom character is the metaphoric heart. And we see kind of like similar characters. This is the move or convey by word. This means to admonish or to guide. This is to move or convey by truck, and this is to transport. But in this character, we have to bring heart to illness. This is the character for the verb to heal. So the key point is the best box we could check was both curing and healing. Both are necessary, neither is sufficient. And when we think about control, govern, fix, or cure, we're thinking about, yes, technical fixes. Healing, we're talking about adaptive responses, both being really important. And so this led to lesson, optimal recovery is a focus both on curing and on healing.